Brain 7 childhood infections. Why vaccination matters. Every parent dreams of seeing their child grow up healthy, strong, and full of energy. But throughout history, childhood infections have stolen the lives of millions of children around the world. Today, we are lucky science has given us vaccines, one of the most powerful tools to protect children from deadly diseases. Yet, even now, some parents hesitate to vaccinate, not realizing how dangerous these infections truly are. Let's explore 7 major childhood infections, including measles and whooping cough, and understand why vaccination really matters. 1. Measles more than just a rash. Measles is one of the most contagious diseases known to humans. It spreads through coughing and sneezing, and the virus can survive in the air for up to 2 hours. A single person with measles can infect up to 18 others. At first, it looks like a simple cold, fever, runny nose, and cough. But soon, tiny white spots appear inside the mouth, followed by a red rash that spreads all over the body. Measles is dangerous because it weakens the immune system, leaving children open to pneumonia, ear infections, and even brain inflammation called encephalitis. Before vaccines, more than 2.6 million people died every year from measles. Thanks to vaccination, deaths have dropped by over 80%, but the virus still kills unvaccinated children every year. That's why the measles vaccine, part of the MMR measles, mumps, rubella shot, is essential. 2. Whooping cough pertussis, the cough that kills. Whooping cough, or pertussis, is caused by bacteria that attack the lungs and airways. It starts like a normal cold, but soon the coughing fits become so severe that children can't breathe properly. The name whooping cough comes from the sound a child makes when gasping for air after coughing. In babies, this disease can be deadly. It can cause pneumonia, seizures, and brain damage. Every year, hundreds of thousands of children around the world suffer from pertussis, even though it is preventable. The DTP, diphtheria, tetanus, pertussis, vaccine is the shield that keeps this disease away. Doctors recommend several doses throughout early childhood to ensure full protection. 3. Diphtheria, the silent choker. Diphtheria used to be one of the scariest childhood diseases. It infects the throat and releases a toxin that forms a thick gray coating, blocking the airway and making it hard to breathe. Children could die within days if untreated. Before vaccines, diphtheria epidemics were common in almost every country. Now, thanks to widespread vaccination, it's extremely rare. However, when vaccination rates fall, diphtheria can come back, and it has, in some countries where people stopped vaccinating. This shows how fragile our safety is. The virus only needs a few unvaccinated people to return. 4. Mumps, the swollen face infection. Mumps is another viral disease that mainly affects children. It causes painful swelling around the cheeks and jawline, and sometimes fever and tiredness. But what's less known is that mumps can also lead to serious problems, like hearing loss, meningitis, or even infertility in boys. The MMR vaccine, which protects against measles, mumps, and rubella, is a simple and effective way to stop all 3. Countries with strong vaccination programs rarely see mumps outbreaks. 5. Rubella, the silent danger for babies. Rubella, or German measles, might seem mild in children, just a light rash and low fever. But it's extremely dangerous for pregnant women. If a woman catches rubella during early pregnancy, her baby can be born with congenital rubella syndrome, causing blindness, deafness, or heart defects. Vaccination prevents rubella from spreading in communities, protecting not just children, but unborn babies as well. That's why herd immunity, when most people are vaccinated, is so important. 6. Polio, the paralyzing virus. Polio is one of the most feared childhood diseases in history. It attacks the nervous system and can cause permanent paralysis within hours. In the 1950s, thousands of children were paralyzed or even died every year. Thanks to the global vaccination campaign, polio has been almost eradicated. Only a few countries still report new cases today. But until polio is completely gone, every unvaccinated child remains at risk. One virus traveling across a border could start the cycle again. That's why continuing vaccination is the only way to make polio a disease of the past. 7. Chickenpox harmless. Think again. Many people think chickenpox is a harmless childhood illness, but it can actually cause serious complications, especially in babies and people with weak immune systems. High fever, skin infections, and even brain inflammation can occur. The varicella vaccine prevents chickenpox safely and effectively. In countries where vaccination is common, hospitalizations and deaths from chickenpox have dropped dramatically. Jigsaw: why vaccination matters. Vaccines train the immune system to recognize and fight infections before they make us sick. They are one of the greatest achievements in modern medicine, saving more than 4 million lives every year. When children are vaccinated, they not only protect themselves but also those around them. Babies too young for shots, elderly people, and those with weak immune systems. This community protection is called herd immunity. But when vaccination rates drop, these infections return quickly. Recent outbreaks of measles in countries with declining vaccination rates are a clear warning. Diseases don't disappear, they wait. Speech balloon: common myths and the truth. Some parents worry that vaccines can cause side effects or health problems. The truth is, vaccines are among the safest medical products ever created. Serious side effects are extremely rare, while the risk from diseases is thousands of times higher. Vaccines do not cause autism. This false claim came from a single discredited study years ago. Hundreds of large scientific studies since then have proven vaccines are safe and vital for children's health. Globe showing Europe, Africa, the global impact. In 1980, smallpox, a disease that killed millions, was officially eradicated through vaccination. Now we are close to eliminating polio and measles as well. Every vaccine given is a step toward a safer, healthier world for the next generation. Seedling conclusion. Childhood infections once filled hospitals, broke families, and claimed countless young lives. Vaccines have changed that story, turning fear into hope. Every time a child gets vaccinated, we write a new chapter in the fight against disease. So remember, vaccination isn't just about one child. It's about protecting all children, everywhere. Healthy children mean a healthy future for the world.